Syphilis is a tiny bacteria that can silently damage your brain, heart, and even an unborn child. It starts with harmless looking sore, but can end with blindness, dementia, or death. Syphilis once killed kings and poets, and it's still here, smarter than ever, because it can mimic any other disease, making it difficult to diagnose. That's why it's commonly called great imitator. That's why I will tell you syphilis signs, symptoms, diagnosis, and treatment, prognosis, and what will happen if it left untreated. Syphilis is a sexually transmitted disease. It is caused by bacteria, small bacteria called Treponema pallidum. It's important because it silently damages your organs, brain, eyes, heart, and other vital organs. It can sometimes disappear after first contact, but the bacteria stay inside. The infection starts when bacteria enter the skin or mucous membranes during sexual contact. Usually it happens during vaginal, anal, or oral sex. The person should have active syphilis lesions. The bacteria is extremely thin, small, and spiral-shaped. They can drill through tissues within minutes. Even without visible blood, they can slip past skin barrier easily. After this, bacteria spreads locally fast, multiplying at the entry point within days. They also enter into blood and start traveling across the body. About 6 weeks after the first infection, symptoms appear. This is called primary stage. At this stage, there is painless sore on the skin, usually on genitals or anus, where the bacteria entered. This sore is smooth, firm, and round with raised edges. Because there is no pain, most people ignore it. At this stage, the person is highly contagious. Any contact with the sore is very infectious. Nearby lymph nodes often swell. No matter if you treat or not, this sore will heal itself within 3 to 6 weeks. But it is tricky, because it makes the person think that the problem is gone. The bacteria still stay in the body. Then comes the second stage called secondary syphilis. It develops after several weeks or months after infection. The bacteria spread into the blood and then to the skin and internal organs and start multiplying. This causes a rash on the palms and soles, fever, sore throat, fatigue. There are swollen lymph nodes in multiple organs. There can be hair loss on the scalp, but only in certain spots. This is called patchy hair loss. This rash is also contagious. This stage can come and go over several weeks to months, but the infection still present. Then comes the third stage, which is called latent stage. There are no visible signs, but the bacteria hide in the tissue and quietly cause slow inflammation. This stage lasts for years, sometimes even whole life, without further signs. If the person is not treated, syphilis can return in the most destructive form called tertiary syphilis. This does not happen to anyone. It happens in about 30% of untreated syphilis cases, but when it happens, it's deadly. This is the fourth stage that occurs years or sometimes decades after infection. The bacteria damage the brain, causing memory loss, personality changes, dementia, paralysis, or even blindness. In the heart, it causes valve destruction, heart failure, aneurysm. In the bone, it causes gumas and destroys bone tissue. Here, the damage is irreversible. Even you kill the bacteria with antibiotics, the damaged organ still present and cannot be repaired. If a pregnant woman has syphilis, Treponema pallidum can cross the placenta and infect baby. This can cause miscarriage, stillbirth, or severe deformities in the newborn. even if mother had never obvious symptoms. Syphilis spreads through direct contact with syphilis sore chancre during vaginal, anal, or oral sex. It can also pass from mother to fetus during pregnancy, called congenital syphilis. One sexual encounter with an infected partner, transmission risk around 30% for unprotected vaginal or anal sex, and slightly lower for oral sex, but still possible. Kissing is generally safe, unless there are sores in or around mouth. Then transmission is possible. Handshake, sharing toilets, towels, or utensils has no risk. Treponema pallidum cannot survive long outside the human body and dies quickly when dried or exposed to air. Doctors confirm syphilis mainly through two-step testing. First is non-treponemal tests. It means that there is antibodies against infection, but not directly towards the bacteria, and we measure these antibodies like VDRL or RPR tests. They are fast, they are cheap, and good for initial screening and for checking if treatment works, because after successful treatment, this antibodies level decreases over time in several months. If the first test is positive, doctor confirm with treponema tests like FTA, ABS, or TPPA. This look for specific antibodies that target treponema pallidum. Once positive, they usually stay positive for life, even after successful treatment. So they are not used to track, recover. They use only for confirmations. If there is an active sore, doctors can take a sample of fluid and look at under microscope with dark field examination, and this can directly show the spiral-shaped bacteria moving. Pregnant women are also routinely screened during early pregnancy, and if they have risk factors for syphilis, they are screened later again, because congenital syphilis can be deadly for the baby, and early detection can completely prevent it. The first-line treatment for syphilis is intramuscular benzathine penicillin G. For early syphilis, one single injection is enough. For later syphilis, or if duration of infection is unknown, injections are given once a week for 3 weeks. Penicillin is effective because treponema pallidum is still highly sensitive to it, even after decades of use, and there is no resistance, and it works over in 95% of cases when started early. If the patient is allergic to penicillin, doxycycline or tetracycline, it can be used, but this requires strict daily dosing for weeks and are less reliable. After treatment, follow-up blood tests like VDRL or RPR. These tests are repeated at 6, 12, and sometimes 24 months to make sure antibody levels are falling. It's a sign of infection is cured. If levels don't drop as expected, the doctors investigate for infection or treatment failure. When syphilis is diagnosed and treated early, full recovery is the rule. Over 95% of cases, success, no lasting damage, but if left untreated, the bacteria can attack the body for years. It can lead to blindness from damage the optic nerve or eye inflammation. It can cause hearing loss from nerve damage in the ear. It can cause paralysis from spinal cord and brain injury, and it can cause heart failure or aneurysm, because syphilis can damage major arteries. And dementia and stroke from brain inflammation. These outcomes are 100% preventable with early detection and treatment, but only if the infection is found in time.